Hey, Dr. Mike here. Are your yearly labs telling you the whole story? Well, stick around to learn about labs to dive deep into your disease risk.
You're listening to Live Foreverish, a show dedicated to helping you live just a little longer. Here's your hosts, Dr. Mike and Dr. Crystal Gossard.
All right, welcome to Live Foreverish. Dr. Crystal, I'm excited about this show. You know, we're going to be talking about some labs I think can be very, very helpful for people to really dive a little deeper into their disease risk for things.
Yep, and we have three categories: advanced cholesterol testing, advanced hormone testing, and GI tests.
So let's get to the cardiovascular. The first one is known as NMR lipoprofile. Tell us a little bit about that.
Yeah, well, we know that your cholesterol is transported throughout the body in these trucks, these transport trucks. And most people are familiar with LDL and HDL.
That's about it.
And that's what your doctor's testing on your yearly
Basic
lab
stuff.
test, maybe twice a year if you're on cholesterol-lowering medications. But that's not telling us the full story. Those transport trucks can be small or large. You can have lots of trucks on the highway causing congestion, or maybe those trucks are able to, they're larger and they're carrying more
stuff,
more goods, more cholesterol throughout the body, which is kind of less congestion. That's what you want.
Yeah, and so it's just it's the basic cholesterol test that your doctor does. It evaluates risk at some level. They can calculate your 5-year cardiovascular rhythm, all that kind of stuff on the basic. But it doesn't, as you said, I love the way you said it. It doesn't tell the whole story. A NMR lipoprofile is going to check LDL and HDL particle values, right? Plus insulin resistance. And we already said you're going to get LDL levels, HDL levels, triglycerides. All of that is a part of it. But it's really breaking it down to that particle level, the size, the shape. Gives you so much more information.
Yes, we know that the smaller particles, they can become oxidized, they can become glycated. Now they can't recognize receptors to drop off the package, the cholesterol, and it really increases your overall risk. Ultimately, we do know you're getting this testing, you're trying to manage those numbers so that you don't have a heart attack or a stroke.
Yeah, a great example, if you do a basic cholesterol test, right? And let's say your LDL comes back at 125. It's a little too high, right? You don't know though. That test didn't tell you about those trucks, right? I want to know about those LDL trucks. Are they small and dense and mean, or are they big and just going along carrying stuff and they're happy, right?
Well, and the same applies to HDL.
Yes, same
right?
thing. Yep.
So a higher number is considered more protective when you're looking at that particle number, since the HDL is kind of removes the LDL by transporting it to the liver. So that you're not going to get this type of information. It lets you know if you how aggressive you should be.
Exactly. I think it's a better assessment of total risk at the end of the day.
Yeah.
And when you know that, you're going to treat better.
That's
all right. The next one is falling under cardiovascular is ApoB. This is one of these non-HDL cholesterol particles, right? That is associated with plaque formation and problems from that.
Yeah. So when we look at your standard test, most people know LDL. They kind of know VLDL, but there are other particles, atherogenic particles, that can contribute to plaque formation. So your ApoB, there's only one ApoB protein on each particle that's out delivering cholesterol. Right. And so this is giving us a true count of those atherogenic particles. Research is showing now it is one of the most predictive.
It's the strongest.
Factors.
Yeah, it's a stronger predictor than a lot of some of that basic stuff you see.
Right. So if you have a higher ApoB, and this is ApoB 100 to be specific, then you can again know how aggressive you need to be to manage your disease risk, or your doctor will know.
Yeah.
We need to be a little aggressive.
The next one is known as the Plaque test. This is based on a type of enzyme. It's called phospholipase A2. It's an indication of vascular inflammation. At the end of the day, a lot of people don't understand. When there's two types of arterial plaques that can form, right? Well, let me back up. The arterial plaques is one thing, right? Mm-hmm. It's a plaque, but they can fall into two categories.
Okay.
You can. Am I saying that? I got to make sure.
Yes.
I'm going to make sure I'm clear.
I think I'm following where you're going.
So you have a plaque. Now, this plaque can be either. It can be dense. It can have a big cap on it, and it's stable. Mm-hmm. It can still cause maybe some pain here and there and stuff like that because it is blocking blood flow a little bit, but it's not prone to rupture.
Yes.
On the other hand, you have a soft, squishy, ready just to explode plaque that then has this huge reaction that causes the actual heart attack. Mm-hmm. So what we want, everybody has plaque, by the way.
So true, Dr.
We all
Mike.
have plaque. We already see it. It develops when we're kids.
Right. And the goal is to keep that plaque nice and stable.
Tight.
Keep the inflammation down.
Yeah, keep it down.
So that the plaque doesn't rupture.
Right. So we want hard plaques, not squishy ones.
Okay.
Well, phospholipase A2 is an enzyme that can make them squishy.
Okay.
That makes
I
sense.
never thought of it that way, but yes.
It makes it squishy. If you have a higher level of phospholipase A2, this enzyme, and you can get it on the plaque test. If your number's higher, that means you have a greater risk of having more ready to rupture plaques versus stable.
Right. And this test is really looking at, since it is an enzyme, we measure enzyme activity.
Right.
And so if that enzyme is really active, you have a greater risk of fatal and non-fatal cardiovascular events.
So we want hard, stable plaques. Leave me alone, says that plaque. And those don't cause those acute, they don't cause the acute event as much as the squishy one that ruptures.
Right. And I also look at this is a lot of times we say anti-inflammatory diet. You need to take these anti-inflammatory nutrients, manage inflammation, test CRP for inflammation. But we're able to see the inflammation in the arteries. This is your typical test
They're
won't
not doing
show
that.
you that.
This is different. This is actually measuring vascular inflammation. Mm-hmm. The higher that number, the greater the risk for squishy, rupture-prone plaque. All right.
Squishy.
I mean, that's not an official medical word, but that's how I explain it to people.
Happy you made that clear. Yes. Just in case.
All right, let's talk now, moving from heart to hormones. Mm-hmm. Come on, guys. Listen, I'm not going to go on my soapbox.
Okay.
Everybody should know hormone levels.
You should, and you should know them when you're younger, so then you'll know what's normal for you, because we are all very unique. Obviously, there are reference ranges that we can go by, but there's you can be your own standard.
Yeah, I just think, think how important hormones are. I mean, hormones are how your brain communicates with the rest of your body.
It's how the body and different parts of the body communicate with each other through these hormones.
They talk to your DNA.
Messengers.
They get in there.
Yes, and they tell your DNA what to do and the types of proteins to make. And, sometimes those proteins are neurotransmitters. Sometimes they're structural proteins like collagen. And so they are very important. I got excited about the collagen.
You did. It was funny. And so what we're suggesting is advanced hormone testing, where it's a complete hormone and urinary metabolite assessment, right? Because that's important too. You can look at your systemic levels of hormones, but also to know how they're being metabolized, and looking at what's in the urine. Again, it just paints a fuller picture.
Yes, and how they're metabolized can tell you a lot about your gut health. It can tell you about your liver health, and it gives you a measurement of whether or not if you're on hormone replacement therapy, is it really working, and is it going down the right pathways?
Yeah. You got to know. I mean, if you take testosterone, in a gel or something, and then all you're looking at is total testosterone, you're going to see that go up. But that doesn't mean you're getting the free testosterone you need out of that. All your testosterone can be bound. So these kind of tests helps you to, again, it's following these hormones all the way down to that tissue level. What's really going on there with these free levels? I think a complete urinary one is a great way to do it.
Yes, and just to clarify, this is a 4 to 5 sample collection. Is performed over 2 days, so it is advanced. You start at dinner time, and ending with a collection 2 to 3 hours post waking. But it's better than the snapshot, the moment in time with the blood testing.
Yeah, because hormones are they go up and down. Mm-hmm. You could be catching it at a peak. What happens when it drops? Where your level? You don't know any of that stuff. So again, I think this is fantastic. Think of a urinary complete hormone test. Let's move into GI tests.
Yeah. So these there are 3 categories. I put them in good, better, and best.
I saw that.
And all it means is that each level is providing a little more information.
Right. No, I get that. So let's look at the good.
Okay.
Why? Okay, so good is good.
Yeah.
It's not better. It's not best, but good is good. Tell us about this stool analysis fecal test.
Yeah, so this is looking at, it's good for, first, why is it good? It's good for anyone with acute GI distress. And it's looking at bacteria, parasites, and viruses that could be, these pathogenic microorganisms that could be causing you GI discomfort.
Right.
So it's a good starting place for you to kind of see what's going on. It's a 3-day collection. So it's a good place.
So, but we have better.
We have better.
There is a better comprehensive stool analysis, right? Just keeping it simple, why is this in the better category?
Well, it's giving you insight on acute and chronic issues 3 months or longer.
Yeah. And that's good because most GI stuff people deal with are in that chronic category.
Yeah, so this is giving you markers of digestion, inflammation, immune function. It contains everything that the good includes, plus stool chemistries, products of digestion. I love this piece. I've had this test done, by the way. Is there fat in your stool? Muscle or vegetable fibers in your stool? Are you able to really digest your food,
right?
Or is it all ending up in the stool? So that's good. Along with those pathogens, you also see microbiome abundance and diversity to give you insight on variety. Do you have dysbiosis? So it's
all that stuff. I like it. No, I think it's good. The best one. Here's why I think you put this in the best category. Right? It's known as GI 360 from Life Extension. It's an amazing assessment of what we call dysbiosis. Right? That's that imbalance between healthy and unwanted gastrointestinal bacteria. It also looks at the diversity of your good guys, and we're learning more and more that the diversity is a big thing, especially in the aging world, anti-aging world.
Oh, absolutely. It's so important, and it's also telling you or measuring H. pylori, the H. pylori antigen. So that's a standout here.
We did a whole show on that.
We did.
Was that a podcast? I can't remember being podcasts on our live shows anymore. Dr. Krista and I do podcasts, Live Foreverish, and we do a live show, which is actually going to become something different called Real Wellness. Going to just start teasing that. Anyways, we did a show
on H. pylori.
We did a show on one of them.
And this is, the H. pylori stool test is a good way to find out if you have H. pylori.
I'm going to encourage you to go check out more of these. We just covered the heart, and just look at all the more detailed assessment you can do to really evaluate your risk better, right? Even if you've already been called high risk, are you really? And you by doing some of these tests, you might move to moderate, just based on particle size. So I really encourage cardiovascular patients, go check these out. Talk to your doctor about them. And you could check them all out at lifeextension.com/labs. I know you're going to promote the gut ones the most, probably, right?
I don't know. I'm into the heart ones.
Yeah.
I am. That's my thing right now.
Okay. I'm good with
laser
that.
focused on heart health.
Yeah. But GI, listen, you're only as healthy as your gut. That's what I believe.
Well, we know that the gut can help the heart too.
The gut. You said that?
The gut.
The gut. Yeah, the gut can help. There, you're right. The gut.
Yes.
There are certain species of probiotics that can help the heart. I know. And then, of course, hormones. Listen, I take testosterone. I've done the comprehensive stuff because I just want to see how my body's handling all this, So fantastic stuff. If you want to learn more, and I encourage you to go to lifeextension.com/labs. /labs.
Easy to remember.
Check it all out there. And then when you're there, use the discount code
podcast.
And you get 10% off $50 or more plus free shipping and handling, all at lifeextension.com. And then you can go to liveforeverish.com.
Oh, we did not plan that. That was perfect.
That was really good. Over at liveforeverish.com, tons of other episodes you can download, like, and share. We need reviews. That'd be fantastic. Sharing stuff is always great. But, of course, subscribe so you never miss a show at liveforeverish.com. I'm Dr. Mike. That's
Dr. Crystal.
Thanks for listening.